So, doctor, we have CV is here. I'm
Mm-hmm.
inviting him.
Mm-hmm.
Uh, Hello, am I
Hello.
audible?
Hi. Yes. Hi. Hi, Shivi.
Yeah, I am CB. Good evening, doctor.
Hi. Hi, Shivi. Good evening.
So, how are you doing, doctor?
I'm good. How are you doing?
Yeah, yeah, very well, doctor.
Mhm.
So, this is for my brother, doctor, and
Okay.
he's around 35 years old. Okay, and recently, last month, he was diagnosed with rectal cancer,
Oh, okay.
and the doctor suggested to go for a surgery
Mm-hmm.
followed by a radiation and chemotherapy. So I checked out
Okay.
with within my circle. So
Mm-hmm.
I know some doctors.
Mm-hmm.
So they told you go for targeted radiation therapy.
Okay.
So I don't know what exactly it is. So that is what their suggestion. Don't go for all these three.
Okay.
Then now I really need a opinion from an expert. So that's why I'm here.
See, once again, you are proving my point that once again we have another viewer who joined with a patient of 35 years of age, telling us that the young patients in India are having colon cancer and there's increased incidence of colon cancer. Once again, my sincere apologies, but definitely. Uh, so rectal cancer, we are, and I don't have the full information, but in rectal cancer, when people with lymph node, when we have lymph node involvement, do you know if the your brother has lymph node involvement or no?
Yes. He do have. Yes.
Okay, so when we have lymph node involvement, we in our American standards, we do not directly go for surgery. We usually either try to do chemo radiation followed by chemotherapy first, for chemo radiation followed by chemotherapy, or chemotherapy followed by chemo radiation. It also depends on the location of the rectal tumor. Uh, Sometimes rectal tumor are very close to our sphincters, the anal sphincter which we have, and if we cannot protect it, we just try to do chemotherapy radiation along with chemotherapy. So I don't know what location of your brother's rectal tumor is. We divide them in high rectal tumor, mid rectal tumor, and low rectal tumors. Do you have any idea which part of the body it is? Is it lower rectal or high rectal?
No, I'm not sure, doctor. So
Okay.
that technical details I'm not
If
sure.
but if your brother has, so radiation alone is not going to be useful. If your brother is 35 years of age, he should get the full extent of treatment. At a 35-year-old age, if it's a lower rectal tumor involving lymph nodes, going with chemotherapy radiation first, followed by chemotherapy, will be my best approach. And then just monitoring him depending on the response of the tumor. That means once he finishes his treatment, he gets the scans again, and the doctor keep using the biopsies of rectum to make sure that the tumor had a good response. If he doesn't have those good response, then he will need to go for surgery. More and more in America, we are trying to get away from doing surgeries for rectal tumor and just monitoring those patients by after getting chemotherapy as well as chemotherapy and radiation together. Single agent, single treatment modalities such as radiation alone or chemotherapy alone or surgery alone are not successful. We usually do radiation alone for very old or frail patients who cannot tolerate chemotherapies or who cannot tolerate surgeries. So yes, we have, your question was, is targeted radiation therapy useful? Yes, it is useful, but it has to be used in conjugation with chemotherapy or chemotherapy radiation together.
Thank you, doctor. Thank you for the insight.